I went into anthropology because I wanted to study the place that I came from. I wanted to study Puerto Rico. I wanted to understand why Puerto Rico was a colony of the United States. And that is a history that is not taught beyond the very basic, 1898, US invaded Puerto Rico, 1952, the Puerto Rican Constitution, right? These basic dates are taught to school children in Puerto Rico, although mostly not in the United States. But there is very little that one grows up having access to in terms of understanding that relationship. And then further, we're understanding the effects of that political setup, right? It's not just a conceptual issue, what Puerto Rico is, how does it fit, what kind of cultural entity is it, what should it be in terms of the future. It's really also about looking into how colonialism manifests on an everyday level. And then the further question, or perhaps the even more important question, is what does decolonization look like, right? So what would a decolonized epidemiology look like? No? Or how does one decolonize public health? No? Exactly. That's a good question. And there's a lot of people asking that question among communities of color in the United States, among indigenous communities, gender, queer, non-conforming communities as well. And so I think it's a very broad effort that goes way beyond Puerto Rico. But Puerto Rico's situation is emblematic of these different zones of attenuated sovereignty, or zones of a democratic deficit, where people are not able to democratically and fairly participate in the distribution of community resources, right? And so we see that another crucial issue in Puerto Rico is that Puerto Rico does not have the full extension of Medicaid that the states have. So the Medicaid monies are apportioned in relationship to the populational need of different states, but that's not how it happens in Puerto Rico. There was a congressional cap that was placed in 1967, I believe, 1967, and has not been revised since, right? So the amount of Medicare funding that Puerto Rico receives, or Medicaid funding that Puerto Rico receives, is directly related to a set number, and has nothing to do with the actual necessities and the lack of services that are in Puerto Rico. And so one can say these are big structural issues, or they're policy issues, but they're also human issues, right? They're also things that affect people's everyday lived experience of having HIV, or of being exposed to HIV, or of caring for someone who has HIV, or of being a service provider, right? And so I was really interested. The reason I went into anthropology was because I was really interested in those very human aspects of the epidemic, right? And when I was an undergraduate at Rutgers, or you asked me about Rutgers, when I was an undergraduate student, I started a Queer People of Color organization that still exists at Rutgers. This year is our 20th anniversary. And we're doing a reunion at Rutgers. I'm very excited about that. Very proud of the young people that are part of that organization now. And as a young person growing up in the 90s in New Jersey, I mean, I was 16 when I went to college, so I was a kid, And as president of that organization, we had the privilege of having all these New York City queer radicals who came to New Jersey to teach us how to protect ourselves against HIV, how to talk about HIV and STDs with our partners, what the politics were, why people were protesting, right? So I was a beneficiary of the education that I received from those activists. And they opened my eyes to the fact that I was growing up in an epidemic, that I was living in an epidemic, And I really wanted to, and then I had some mentors who basically charged me with doing that kind of research in my graduate work. So then when I went on to do my PhD, I decided to focus on the history of epidemics in Puerto Rico, but more specifically, I've decided to focus on doing ethnographic work around HIV/AIDS in Puerto Rico.